been asked to explain some of the issues around alcohol and other drugs and how we're working to address this across Dorset. Firstly, they may use some substance themselves, or secondly, they may be influenced by their parents or those around them using substances.
So people use alcohol and drugs for a variety of reasons. Some people are able to control and enjoy their drug use without causing any significant harm to themselves or anyone else, but other people find this a lot more difficult. So often the people who experience the most difficulties in controlling their use of substances are people who have faced particular challenges in their early lives. So for example, they're much more likely to have experienced verbal abuse, physical abuse, sexual abuse, or things like household dysfunction. So where they've grown up around domestic violence in the house, mental illnesses, drug use or alcohol use by the parent. And together these risk factors are sometimes referred to as adverse childhood experiences, and they're also known as ACEs.
So if a young person is using substances problematically, this can affect their physical health. So it disrupts their sleep patterns and causes like weight loss, for example. And it also affects their mental health. This can in turn affect their performance, like at school, and also their relationships with family and friends.
So substances are often used to bring in young people and entice young people to do things that they wouldn't otherwise do. That can be getting hold of drugs, and that can be because they're already under the influence of drugs. And this can lead to further exploitation, one of which is drawing young people into the supply of drugs, and that's often called county lines. So those kind of experiences where young people are exploited often drives them to use substances in more problematic ways. The reason they're doing that can be to escape or to manage the trauma of the situation they find themselves in, and that in turn potentially makes their situation worse, and they engage in the vicious cycle of exploitation and substance misuse.
But it's not only their own use of substances that can make a young person vulnerable, they're affected by the behaviour of people around them. In terms of parental substance use, around 20% of children in need are affected by drug misuse, and around 18% are affected by alcohol misuse. Parental misuse of alcohol or other drugs feature in a quarter of cases on the Child Protection Register. Drug misuse is involved in 38% of serious case reviews, and alcohol misuse in around 37%. It's estimated that across Bournemouth, Poole and Dorset, around 1 in every 100 adults is dependent on alcohol, which works out around 8,000 people. We know that many of these people will be living with children. In fact, the government estimates that in our area there are almost 3,000 children living with someone who's dependent on alcohol. And it's not just alcohol that's the issue. There are around 3,000 people using heroin or other opiates in Bournemouth, Poole or Dorset, and again it seems this affects around 3,000 children. But the good news is that there's support out there for the people who run into problems with substances, whether they're parents or the young people themselves. Through REACH in Dorset and Addaction in Poole, EDAS have a fully equipped team of professional staff ready to engage with these young people, whichever the problems are with alcohol or other drugs, and we work up to the age of 24.
And in Bournemouth, support's available through Addaction. So however big or small you feel the problem might be, the team can offer the full range of treatment options, from one-to-one support to group support to counselling and to detoxification if that's what's required.
So the service is set up to offer appointments in a range of locations suitable and convenient to young people. This could be within school, home, youth club, advice centres, or any locations really that are suitable to them. There's even a web chat facility if the young person prefers to be doing it digitally instead of face-to-face. And we can also offer phone contacts as well.
And there's support for parents of people experiencing the issues around substance use, so that parents and loved ones can get the support that they need, often from people who've been through that same experience.
In 2008, our services engaged with a total of 800 young people across Bournemouth, Poole and Dorset, and over half of them engaged in structured treatment and changed their substance use. 350 young people who engaged with this service completed their course of treatment successfully within that year, and then left free from dependence from alcohol or other drugs. If you're not sure about making a referral, or the young person isn't keen to engage with substance misuse services at the moment, we can still offer you support and advice and guidance. Pick up the phone and give us a chat.